Hi, everyone. I'm Sharon. I'm an RN and the clinical supervisor at the Community Health Clinic. And I'm here today to talk a little bit about one of our outreach clinics. So at the CHC, our mission is to serve our local community, both plain and non-plain, as well as other plain communities across our greater region. So during the CHC's first 5 years, we had patients present from various places across the Midwest, either seeking a diagnosis for a child with special needs or looking to establish care closer to home for a family member or child that already had a diagnosis. We had quite a number of patients come to the clinic from southern and southwestern Indiana, including Washington, Davies, Park, and Orange counties. But for those families, travel to the clinic was often difficult, especially with a special needs child, as well as expensive. Most of the children really needed to be seen several times a year in order to maintain, make sure they were getting the services they needed and staying as healthy as possible. But again, it was difficult for families to maintain that. So through conversations with a midwife in southern Indiana, her name is Heidi, it became apparent that there was a significant need for genetic services in Orange and Washington counties. So in June of 2018, Dr. Z and several CHC staff members, including Debbie, our operations director, and myself, traveled to Paoli to hold an education day. The purpose was to kind of get a feel for the need in the area, as well as meet potential patients and collaborators. 32 plain community members, as well as 3 non-plain community members attended the event, and including Dr. Yoder, who is a primary care physician with a practice in Paoli. Dr. Yoder approached us at the event and offered her clinic space if we were to decide to offer services locally. Since this was an hour drive from Davies County and a 2-hour drive from Park County, where we already had established patients, it seemed like a great option. In addition, the response from the providers and the families that attended the event confirmed the need for our services. So in March of 2019, we held our first clinic in Paoli. We returned every 3 to 4 months to see new patients, provide follow-up care for our established patients, as well as provide community education. The clinic continues to grow. We typically have 2 to 3 full days of patient appointments and are continuing to see interest in and need for our services. COVID has, of course, affected this clinic like everything else in our lives. And in order to protect our patients, we are using a church building currently as an alternative clinic site. We are so grateful for Dr. Yoder, Heidi, and other collaborators, as well as each one of you that continues to support the CHC in the vital work that we do serving vulnerable populations. Thank you so much.